Hi, I'm Dr. Brownfield, and I'm a veterinarian here at Grady Veterinary Hospital. I'm going to talk to you today about heat stroke. So heat stroke is something that I commonly see in the warmer months in the emergency room here. We tend to see it happen mostly in dogs, although it can happen in cats as well. And what that typically entails is a really elevated body temperature, which can cause kind of a cascade of inflammation throughout the body that can really do a lot of damage to the body's organ systems. One of the big things, the reasons that we see this is dogs that are left in cars when it's too hot, and it doesn't really even have to be really hot outside, but being in that enclosed small space for even a short period of time can really elevate their body temperature. We also see it when dogs are not acclimated to the warm weather appropriately. So we'll see dogs that owners maybe take out for a run for the first nice day of the year, even if it's not really hot, they just haven't been able to acclimate to that warmer weather and they get overheated. The other reason that we can see this is in dogs that have trouble breathing. Either they have a known respiratory condition or they're a type of breed where they just don't breathe as well anyway. A lot of this is seen in what we call brachycephalic dogs or smush-faced dogs, like bulldogs and pugs. And those dogs can't breathe effectively in order to cool themselves off, since dogs pant in order to keep themselves cool, since they don't sweat like we do. Those dogs can't pant effectively, and so they tend to get a really elevated body temperature. And we'll see these guys come in. A lot of times the signs of heat stroke include really loud upper airway noise and breathing, bright red gums. If you have access to a thermometer and you can take a rectal temperature, we consider a heat stroke anything over 105.8 degrees. And then we can sometimes see severe weakness, neurologic signs like seizures, tremors, or just being mentally unaware of what's going on. And we can see abnormal bruising develop as well. The way that a heat stroke can affect a dog is it can make them go into organ failure. It can also cause brain swelling and problems with blood clotting. And so we can see really bad bleeding from the GI tract. We can see bruising on the abdomen, the gums, the ears, things like that. And so if you're noticing any of these signs or you think your pet's overheated, you definitely want to get them to a veterinarian as soon as possible. The things that you can do at home before coming in, if you do take their temperature and you find that they are overheated or you suspect, we typically recommend giving them a cool bath, not a ice cold bath. You definitely don't want to shock their system by taking a really hot dog and putting them into an ice cold water bath, but you can cool them down with kind of lukewarm water, put some wet towels over them, and just get them straight here so that we can continue treatment. If you are monitoring their temperature and their temperature is approaching 103, kind of going down, that's when you want to go ahead and stop cooling, dry them off, because they can then rebound into a low body temperature after that. And most of these guys do end up needing to be hospitalized for multiple days, and they can actually pass away from heat stroke due to a lot of the complications. And so the best way to prevent it is really try to go slow with reintroducing exercise when weather gets warm, making sure we're not taking dogs that have a predisposition to breathing abnormalities and keeping them out in the sun or the heat for too long, and then just making sure we're not leaving them in cars or small enclosed spaces when the weather starts to get warm.